You've probably looked at a spot on your face before and thought, I wonder if I can have that removed. My name is Dr. Jordan Carqueville. I'm a cosmetic dermatologist, and I've got your back. So by the end of this video, you'll know what to expect with cosmetic mole removals and how to do it safely and effectively. So moles are incredibly common. Almost everybody has them. Most of the time they're harmless, but they can change in shape, size, and texture over time. If you do notice any changes to a mole, it is always a good idea to get them checked out. Even though many of these can be benign, a lot of people want to know their options about removing them for cosmetic reasons. And I get it. A lot of times these can be unsightly, and we want them removed for our own happiness or self confidence. So here's the good news. So the process of removing these is quick, safe, and done with minimal scarring if performed by a talented surgeon. Before we remove anything, we always evaluate it first. When a patient comes in to have a mole evaluated, we are looking for signs of atypia. If that mole looks totally benign and totally normal, it might be deemed as just a normal benign mole. Once we know that mole is not threatening, we can talk about options to remove it. There are two main options in the way we remove moles. One is a shave removal, and the second is doing an excision with stitches. So let's break those down. Depending on the location on the body of where this mole is, such as the face, we want to choose the best procedure that's going to leave the best cosmetic outcome. Some parts of the face are more curvy, and some places have more of a shadow where you can hide a scar. So depending on the convexity or concavity of the skin, we'll choose the best procedure for you. A shave removal is when you numb up the mole and you just shave it flush with the skin. There's no deep cutting or sutures involved. It's quick and easy. A cosmetic excision of a mole is when we use a scalpel to precisely remove the entirety of the mole, and then we close it very neatly with stitches. Now, here's what I tell my patients. Mole removal is as much of an art as a technique. My goal in these cosmetic mole removals is to leave my patient with the most minimal scar possible. I want my patient to have smooth and natural looking skin in the area that the mole was removed. Now, I can't promise there'll be no scar, but we want to optimize that scar in the best way that we can, whether that's going to be with that shave removal or the excision. Aftercare is extremely important. I recommend immobilization of the wound as best that you can, proper sun care protection, and that scar will improve over time. One pro tip is that you can start lasering a scar as early as 6 weeks to get the best outcome, and we can talk to you about that too. So if you're in the Chicago area, feel free to give us a call and we'll get you in right away. And if you want to learn more about skin health, please feel free to subscribe to the channel. We'll see you in the next one.